Hello and welcome to week 42 of Addressing the COVID-19 Crisis, our open forum webinar series for pharmacists, and we are so excited that you're with us. I'm Michael Hogue, Dean and Professor at Loma Linda University School of Pharmacy in Southern California and the President of the American Pharmacists Association. It's my pleasure to host this broadcast each time that we host it, and we're excited to talk to you today about how pharmacists are partnering with public health departments in local communities in order to increase COVID-19 vaccination in underserved areas. I'm also very excited to share with you today that we're offering continuing education for those of you who are joining us live, and we'll go over the details of that in just a moment. But first, I'll go over the profiles of those who are joining us in this webinar. First, we have Dr. Jacinda Abdul-Mutakibir. We call her Dr. Jam here at Loma Linda University. She's an assistant professor of pharmacy practice here at the school and a critical care and infectious disease specialist at the Loma Linda University Medical Center. She completed her doctorate in pharmacy at the University of St. Joseph School of Pharmacy and went on to earn a Master's of Public Health at Wayne State University. And she has done a tremendous amount of work in public health. In fact, she won the U.S. Public Health Service recognition in 2017 for her work in public health. And we'll be talking to her about some initiatives that she's doing in San Bernardino City, California, in underserved populations. We're also pleased to have joining us today Allison Reichert. Dr. Reichert is a pharmacist, independent community pharmacy manager at Bodie Pharmacy. She currently coordinates Bodie Pharmacy's COVID-19 vaccination efforts and brings in-depth experience in community outreach, medication compliance, and patient education. The Bodie family has owned and operated community pharmacies that have served rural communities for over 100 years with areas of focus such as mobile vaccination clinics, prescription medication packaging, and establishment of equitable healthcare access to underserved and rural patient populations. Now, I'll just disclose to our audience today that both of these pharmacists have a personal connection to me. As I disclosed, Jacinda is an employee at Loma Linda University, and so she works within our health system. Allison Reichert is actually the pharmacist in my hometown in Southern Illinois, Vienna, Illinois. So she's actually my mom and dad's pharmacist. Excuse the voice problems I'm having. So it's going to be exciting for me today to talk to you all and interview you about your expertise. Joining us this week, just like we do every week, is our experts at APhA on staff, Dan Slott, our Senior Vice President of Education and Business Development. If you've not been with us before, Dan's background is that he had a 10-year stint with the National Cancer Institute at NIH working with immunotherapies and cancer drugs. So he talks to us about any clinical considerations that come up today during our webinar. We're also joined by Mitch Rotholtz, our Chief of Governance and State Affiliates for APhA. He's also the Executive Director of the APhA Foundation. And Mitch is our primary liaison with the CDC and other coalitions and stakeholder groups that deal with vaccines during the pandemic. We also are joined by Elisa Bernstein, Senior Vice President of Pharmacy Practice and Government Affairs at APhA, and we'll be hearing from Elisa later on in our program. But we'll also have received several questions in advance, and some of those are going to be directed directly to Elisa. So that's our group, our panelists that we're going to have today. Let me go through some of the disclosures and some of the issues with CE so that you can get prepared to earn your 1 hour of CE credit. These are our disclosures. And let's move on to our learning objectives. Target audiences for pharmacists. Our learning objectives are listed here. I'll give you just a moment to take a look at those. And now let's go over the format for today's, we're going to do these pre-questions first. My apologies. So take just a moment. Which of the following is not an example of how pharmacists can partner with their community to increase COVID vaccination? I know if you're like me, when I was a student, I didn't like these knot questions because they tied me up in knots. Hopefully you will do better at a knot question than I typically do. Okay, just click on your screen, folks, the answer that you think is the best answer, and we will wait until the end of the broadcast to actually show the results of this poll. All right, let's move on to the second question. The second question is also a not question. Which of the following is not a strategy that pharmacists can use to reach eligible patient populations that are immobile? So give us your best answer here. You've got 4 choices here to choose from. Your best guess is acceptable. It doesn't have to be a perfect answer by any means, just your current thoughts. And let's go now to our third question. Which of the following is not a strategy to build trust in the community? It looks like we were really tied up in knots this week. 3 questions, all with knots. That means we must be hearing today about a lot of great strategies from our speakers, so we're excited about that. Okay, let's move on. So what we'll do today, like we do every week, is we'll interview our guest today and get their insights and information about our subject of community pharmacies partnering in public health. We will then also begin asking the questions that you have submitted. Some of you have submitted questions in advance. And for those of you who have not been with us before, in the GoToWebinar control panel is a questions box. We ask that you go ahead and enter any questions that you have as they come to your mind. You can add questions into the question box now. Several of you are already doing that, and that's wonderful. We'll try to get to your questions early on in the program. But anytime you think of a question, add it to the question box. We'll answer just as many of them as we can. We are recording today's webinar. The recording will be posted at pharmacists.com in the coronavirus resources page tomorrow. For those of you who are joining, you get CE if you're live. If you're not joining us live, unfortunately, we're unable to offer CE for today's program, but it still has lots of good information, so stick with us to the very end if you're joining in the asynchronous environment. Also today, there is a handout in the Handouts tab. You can download that to your computer. Click on the links that are in the handout, and they take you directly to the resources that are being referenced today. These handouts tend to be pretty useful for most of our attendees, and we get great feedback about the handouts. So hopefully that'll be helpful to you as well. All right, now I think I've gone over all of the ground rules. I'm going to ask Allison and Jacinda if they will join us on screen. We are excited to have both of you. Hi, Jacinda. Hi, Allison. All right, let's make sure your audio is on, and we're going to jump right in. Allison, you live in a very rural area. Your pharmacies are in a very rural area in Southern Illinois. Could you tell us how you're working with the public health department, you know, how you establish those connections, and just how you made all of that work?
Yeah, absolutely. So our health department covers the 7 most southern counties in the state of Illinois. And with that, the geographical area is the size of the state of Delaware. So they cover a really large area. And with that, they only had 5 vaccinators on staff. So going into COVID vaccination, we knew that they were going to need more providers, just simply to cover the area they had. So I, being in a rural area, already had personal relationships with the profession, with the people at the health department, and also professional relationships. I do serve on the board of health at our local health department as well. So I had made those connections previously, but I really just reached out early on to our health department and said, you know, what can I do to help you? I know that this is going to be a big undertaking, and you know, I have these resources, I have this skill set that I can use to help you, and I'm happy to do so in whatever capacity that you needed.
So to kind of give our listeners a little bit of context, I mean, an area the size of Delaware covered by one health department, that's a pretty incredible landmass area to be covering. if I'm not mistaken, Allison, the two counties where your pharmacies are located, you are really about the only healthcare provider that's there day in and day out. Is that right?
Correct. Yes. So our pharmacies, and we're in 2 of the 7 counties. We have two independent pharmacies, and we're the only vaccinating pharmacies in those counties. And actually, for COVID vaccine, we're the only, day in, day out provider with only 5 vaccinators on staff. Our health department has had to rotate which county they're in each day to give vaccines. So we're kind of the only stable day-to-day spot in each of those counties, and we're labeled as critical access pharmacies for a reason. Even within our whole region, the Southern 7 region, only 2 of those counties have chain pharmacies or big box stores. So, and those aren't the ones that my pharmacies are in. So there really was a need for other providers besides just the health department.
Wow, that's pretty amazing. So, could you just tell us a number about how many doses of vaccine have you administered so far in your pharmacy?
Yeah, so I myself, we have administered 700 vaccines through our pharmacies. I have 2 clinics scheduled this weekend, and based upon what we have scheduled, we should cross that 1,000 mark this coming weekend. So yeah, we started with long-term care right in the very beginning, and then as the state has progressed through the phases, we have progressed as well.
Well, that's fantastic. Jacinda, I'm going to shift over to you now, and let's talk about your practice. Now, you have been particularly active in faith-based partnerships. Tell us a little bit about, you're working primarily in a suburban inner city area, is that right? And then tell us a little bit about these faith-based partnerships.
Right. So Loma Linda, of course, as you know, Dean, is uniquely positioned with us being a 7-day Adventist university to where we have we have access to different faith-based organizations. One being one that is comprised of majority Black faith leaders. So we've been able to really leverage those relationships and really use those faith leaders as advocates for the vaccine. So in particular, with the first vaccination clinic that we did have, we kind of tapped into a relationship that we have with ICAC, or the Inland Empire of Concerned African American Churches, and that's comprised of about 20 churches and 20 pastors that meet regularly to just discuss things that plague or are affecting the Black community, especially in the Inland Empire, or like the San Bernardino, Riverside areas in California. So we were able to really talk to them. And one thing that we saw that was important to really engaging and really encouraging and developing that trust and relationship was the delivery of education from a like practitioner. So in that case, myself, I've served as the trusted voice for us when reaching the Black community. And I have delivered information webinars in relation to the COVID-19 vaccines. So I always talk about how I had to go through the Black faith leaders first before I was able to get to the rest of the community members. So I had to deliver the presentation and really just talking about the vaccines in lay terms, and in a way in which they felt comfortable with the way that I delivered the information, and they felt like their constituents, or their parishioners anyway, could pick up the information had they relayed exactly what I said. And from there, once they were satisfied, I was able to receive access to their church members, and I was able to reach about 60 to 100 individuals via a Zoom meeting where we had a call, and I delivered the information I had given to the pastors previously. And I think that really encouraged those that may have been on the fence about getting the vaccine, that encouraged them across that finish line. But I think that, also with that, Loma Linda is a very diverse university in itself. So not only was I able to be there at the vaccine clinic as the pharmacist that handled the vaccines, meaning that, before a vaccine left to be injected into someone's arm, the vaccine reached me first. or had to be approved by me first, which I think was another means of establishing trust with the community members. But we also have just an immense amount of just diverse students and diverse pro individuals that served as immunizers in the clinics. And I think that that also just kind of, assisted in developing that trust and relationship required for the successful delivery of the vaccines. So,
Yeah.
yeah, I think that Loma Linda is very unique in the way that we are able to approach these faith-based organizations. But I think that the approach that we've developed is one that a lot of pharmacy schools, a lot of minority pharmacies could adapt and go forth and use to deliver equitable access.
So Jacinda, I think it's important, and we've talked about on this program before, how Black and Brown communities have been disproportionately affected by COVID. We've seen a higher rate of morbidity and mortality among both Black and Brown communities. And there's a significant amount of distrust with the healthcare system because of long-term systemic racism that's existed in the healthcare system across the United States. And so, I think what you're doing speaks a lot to trying to break down those trust barriers. Do you think, and I'll be very pointed and blunt about this issue because I want to speak frankly and I want our listeners to hear clearly. Do you think that the fact that you are a member of this community may have improved the communication? And what about partnerships with healthcare professionals of color to help make this successful?
I 110% believe that myself being a Black woman, that my representation as a healthcare professional providing information is what's helped, increase the trust. And I think that that's been such an important part of our model. And I think that it helps to have me there to actually dispel those myths, as those myths are very, well, not myths, but those realities, excuse me, of systemic racism are woven within the integrity of who I am today. So I am very closely related to medical distrust that minoritized individuals experience. So I've been able to very pointedly dispel any untruths that may be linked to that, but also just serve as an advocate for them and to ensure that and I think that me actually seeing the vaccines before they go out is probably a bigger point than me actually delivering the information to them, because they know and they trust me when they hear my voice in the background, drawing up the vaccines. They say, I've heard them say, that's Dr. Jan back there. I know that I'm safe because she's the one, drawing the vaccines, because they know me, they trust me, and they know that I wouldn't allow anything, bad to happen to them.
Yeah, so Jacinda, I think one of the points you're pointing out here is that it takes time to establish trust. And one of the things that's very different with COVID vaccines is, with flu shots, I think pharmacy takes a more passive approach. If people walk in and ask for a flu shot, we'll give it to them. But this requires a little bit more of a proactive approach. So Allison, can you tell us, have you engaged in some proactive activities also to help do education in your communities in rural Southern Illinois?
Yes, certainly. So like I said before, we got involved very early on with long-term care, and even with that, those residents that I vaccinated were ones that I had relationships with before. We service medications to those facilities already, but even still, we had residents who were hesitant and who, weren't sure they wanted to get vaccinated, and whose, honestly, families weren't sure if they wanted them to be vaccinated. And so I provided education to them and also to the staff of those facilities as well. And so we did that. And then also just, within our own community at the pharmacy, we have also reached out to local churches and community centers. That's where we're holding our clinics at this weekend. And so even with that, just by holding our clinics at the churches and at their, community center gyms, I think gives people a sense of safety, knowing it's a familiar place. And, I think that gives a kind of a sense of safety and reassurance as well. But
Sure. So let me just ask both of you real quickly so that our audience knows. Jacinda, you talked about a mobile clinic. Allison, you've talked about going into nursing homes and mobile clinic. Are both of you using the Moderna product? Is that right, Moderna?
Correct.
Correct. Both
Yes.
of you are using the
Yes.
Moderna product. Okay. So let's just talk about this. I know this is nitty gritty logistics, but I think our audience may want to hear the logistics also. So when you receive the vaccine at the pharmacy and you transport it to a location, how do you do that? How do you maintain temperature and all of that? What's the logistics? Can you just give me a little bit of a rundown? I know you both probably have the same answer to this question, but Jacinda, why don't you tell us your process for that, and then Allison will let you comment if there's any different things that you do.
Absolutely. So this is a process that I've become very closely acquainted with. So what we do is we use a cooler. So it's the Playmate cooler. I'm sure everyone had when they took weekend trips to the zoo, but we use a Playmate cooler. And then we also have a refrigerator that we take with us to every vaccination site. So wherever it is that we go, pop up with our mobile clinic. So in that Playmate cooler, we keep gel packs for the vaccine. So we also keep a thermometer that's been calibrated so that we know that we'll get a proper read on the temperature. So we place that thermometer into the Playmate cooler, and then we test it into the Playmate cooler, which has the ice packs inside of it already. And we test that temperature to make sure that it's within the 2 to 8 degrees Celsius range. Once we get a proper read on that, then we then get the vaccines from wherever it is that we'll need to transport them from. So whether it's the medical center, whether it's an additional site that we have at Loma Linda that may have the vaccines, I meet them probably 20 to 30 minutes prior to the clinic to go retrieve the vaccines from where they're keeping them. And then once I meet the individual that'll be giving me the vaccines, I then put them into that Playmate cooler, which I know is within range as far as the temperature is concerned. I then move that cooler to the site, and we plug the refrigerator in, and we kind of do the same thing as far as temperature, the same thing that we did for the cooler. However, we do it for the refrigerator. So we place the thermometer into the refrigerator to make sure that the range is within 2 to 8 degrees Celsius. And then we move the vaccines from that cooler to the refrigerator. And the CDC has a nice temperature log, and we just log the temperature every hour on the hour to make sure that it's been within range the entire time. But the students do a phenomenal job, the pharmacy students, and they always, alert me, Dr. Jen, we're at 4 degrees, we were at 6, or we're at 4, we're at 7, and we were at 4. So they do a really good job helping me keep watch.
Sure. Allison, any other tips you have on the storage and handling issue?
Yeah, ours is very similar. Our data logger actually has an alarm on it, so if it gets out of range, it'll alert us. But we do the same thing, logging our temperatures. We use a cooler, and we have a portable refrigerator. Our portable refrigerator actually works as a freezer and refrigerator, so we're actually able to transport. In the beginning, before the health department was able to ship directly to us, it was all via redistribution. So it came to them, and then they redistributed to us. So we were actually transporting frozen that way. We actually used their portable freezer to begin with. We kind of shared equipment there, but we have our own now. And so we use that with our data loggers when we record our temperatures and all of that. Yeah.
Yeah, and so I know the California Department of Health requires that we have to log in our temperature to the state health department. And Allison, I assume you probably have to do that too. Transit temperatures have to be logged in.
Every day. Yep.
Yeah, so just so that our listeners know, conducting these mobile clinics takes a lot of heart and a lot of effort. But I'm so proud of pharmacists because we've all stepped up in our local communities and gone above and beyond what's normally expected in order to meet the needs of our community, despite the fact that there's a lot more logistics involved with these vaccines. We still make sure that it happens. Now, I'm going to start mixing in a few of our audience questions with the questions that I had for you. I'd like to understand a little bit about how you establish a trusting relationship with someone you've never met before, and you've only got 5 or 10 minutes to spend with them. Can you give us any tips on how you effectively establish a trusting relationship with a person who's really not been your patient before, but is in front of you and has questions or maybe even doubts about the COVID vaccine? Allison, let's start with you this time.
Yeah, I think a lot of that is listening, listening to what they have to say and really taking into account their concerns. Of course, knowing the background on the vaccines and being able to effectively communicate the science behind it in a way that they can understand is important. And so that's something, I really tried to educate myself on prior to conducting these clinics and that sort of thing. But I think really listening to their fears and then being able to relate. Of course, the question I get the most is, did you get the vaccine? And, they want to know which one I've got. And I personally received the Moderna vaccine, and that's what we're giving. So that's kind of been an easy way to establish trust. They see that I'm still there and I've had it for several weeks now. So yeah, really, but I think really listening to them and seeing what their fears are exactly, and just trying to kind of explain the science to them in a way that they can understand.
And what's the greatest, Allison, while I've got you, and then I'm going to shift over to Jacinda. Allison, could you tell me what is the number one question that you get? Is there one question that you seem to get more commonly than others, in terms of an objection or concern from patients? What's the most common concern you receive?
Well, honestly, the most common concern I receive is, am I going to feel bad? And how, is this going to make me feel bad? Am I going to be sick? Do I have to miss work? A lot of people just, as the pandemic has gone on, or if they have a job, they're thankful to have a job and they, want to be able to go to work. And so we do a lot of our clinics on the weekend here for that reason. So that way we do them on Saturdays. So that way on Sunday they have a day off or hopefully have a day off so that they can recuperate if they do feel bad or that sort of thing. So I think honestly, that's really the big question I get, and hesitancy. And honestly, there are people that don't want to get it just because they don't want to feel bad and, they're afraid of missing work or that sort of thing. So, yeah. So,
well, that's good insights. Jacinda, tell us about your experience. How do you establish a trusting relationship when you've only got 5 minutes with a person?
I think that, and I think Allison's approach is key. That's something that I also use in my approach. So I establish just an environment of empathy rather than, not just immediately coming into it, making the patients feel like their fears are displaced. I'm empathetic to what it is they may be fearful of. And I approach every presentation that I give, I approach it from a standpoint of lay terms, and I give it to my husband, who is not a pharmacist first. And I make sure to kind of like pinpoint areas where I may be speaking up here. I have to give me feedback, which I think has helped because it's allowed for me to kind of find anecdotes or analogies that I can use to make the information more relative to the individual that I'm giving it to. And I try to always approach it I try to draw on my charisma and really just use a charismatic approach, when I'm talking to them. I want them to feel comfortable with me, comfortable enough to where they can actually, they can actually address what it is, their fear is. I don't want them to, address the fear that they feel is the most politically correct to bring up. I want them to feel like they can say whatever it is that may be, keep them from crossing that threshold. So I think
what's the most common question you get, Jacinda? Kind of asking you the same question here I ask Allison. Is there a single most common question that you get?
The most common question, and honestly, it depends on the audience. So the most common question that I get from the Black audience is, how is this different than the Tuskegee experiment? And I always just make sure and I think that it comes from a standpoint of let's educate on what the Tuskegee experiment actually was. It was terrible, but the vaccines that we're getting now are completely different in that, these are treatment. This is a treatment that we're actually receiving, or a prevention measure we're receiving to not get COVID-19. So, in the event that this was like Tuskegee, that wouldn't necessarily be the case. So I make sure to explain that. And then when I'm talking to individuals that may not be from the Black community, it's the question of, well, will this be integrated into my DNA? And I always, and this is something that I pulled from, talking to my husband and getting some anecdotal analogies was, to equate the DNA, the RNA, and the mRNA to a moon and a honeymoon. So, you have the moon and the honeymoon, which have the same base, however, they're completely different. So that's something that I use when explaining DNA, RNA, and mRNA, which has gone over pretty well with the group. I've seen like the clicking happen when I say it in the presentation. So that's good.
That's great. That's good. Well, let me move on to another area here. I want to talk about getting information out, Allison, in a rural community. So in urban environments or even suburban environments like we're here in Southern California, there may be a lot more communication mechanisms available in terms of a lot more television stations, radio stations, news outlets, and so forth. But in rural areas, that may not always be the case. What have you found as an effective mechanism to let the people who live in Southern Illinois know that COVID vaccine is coming and that you have it and that there's a mechanism for them to be able to get it?
Yes, so as I mentioned before, only 2 of the 7 counties have a big store, a box store, a chain pharmacy in it. And so all of the other providers in our area have been in the state program with our health department. So we've all had Moderna vaccine. And so I feel like that has really allowed us to kind of have a united front in that the information we're providing about the vaccines are all the same. We all have the same thing. We're all doing the same thing. And so we have all really we've used social media quite a bit to get information out there. But in my pharmacy, in a rural community, I always go back to this. There's really nothing like word of mouth in a rural community. It travels fast, and it's kind of a joke amongst my pharmacy staff. They always know when I'm scheduling because the phones light up. The moment I schedule that first appointment, the phones light up and everyone else is calling to schedule their appointment or wanting to know when their appointment is. So in a rural community, honestly, word of mouth is one of our biggest forms of communication. And also in my pharmacy, I've always found that bag flyers. So when we started making our list of patients who wanted vaccine and were interested, we started it with a bag flyer. We put it on their bags when they picked up their prescription, and then they knew to call. And we listed the information that we would need, comorbidities and things like that we would need to appropriately phase them. So when they called, they were able to provide us that information, and we could make that list, so to speak. So.
Great. Well, that's good. So I think what I'm going to do now is start moving into some questions for our other experts as well. Let me start out, Mitch Rotholtz, with you, if you don't mind also joining us on screen for just a moment. I'd like to ask you to kind of help us out. We've got some audience members who are wondering, why are independent pharmacies nationally seeming to be slow to receive the vaccine, whereas chain pharmacies seem to be getting a lot of it? What can you explain how the distribution process is working and how the feds are distributing vaccines versus how the states are doing it?
Okay, good question, Michael, and I'll do the best that I can with the knowledge that I have at this point. So there are 2 mechanisms for community pharmacies and other pharmacies to engage in the vaccination process. First is working through your state health departments, utilizing their allotment of vaccines. So the state would basically tell you that you're going to get X number of doses from their allotment. That's one mechanism. The other mechanism is through the Federal Retail Pharmacy Network. In that network, there are about 40,000 pharmacies who have enough of a volume, which was about 200 pharmacies per network or corporation that were able to register into this network. Out of those 40,000 pharmacies, they represent about 21 networks, which includes national chains, regional chains, as well as networks of independent pharmacies like CPSN. And those are ways that pharmacies can enroll to get vaccine. Out of those 40,000 right now, about 9,000 are getting access to vaccine at various amounts, and that's through a coordination between the network coordinators and the state and CDC. It's ramping up. We saw this week that there was an increased number of vaccines that were made available both to the states as well as the federal networks. The goal is that we'll have sufficient amount of vaccine available that all the pharmacies that want to vaccinate will have access to that. The process is slow, unfortunately, and that's what we're dealing with. But if you have not been in contact with your state health department to let them know that you want to participate and be sure you're on their list, as well if you have the opportunity to have been registered in the federal network, those are the two ways. Unfortunately, it's not an easy answer. Each state is handling it differently in terms of their priorities. Then we heard yesterday or 2 days ago, the president had said that the new Janssen vaccine was going to be targeted to teachers and had mentioned that it was going to be distributed through the federal network. Again, we don't know if does that include just the ones that are in there now, expansion of that, which we are assuming that it'll be expansion to the 40,000 providers. So it's still, information is coming out each week. We're getting different information and updates as more supply is becoming available.
And Allison, I think if I'm remembering correctly from our conversation, so you received your distribution directly from state allocation. So the states were allocated, using Mitch's example, the states were allocated and then the state health department allocated to you. Is that correct?
Yes, so we've done it actually two ways through our health department. So initially, the state allocated directly to the health department, and we were involved so early on that the only way for me to get it was from redistribution. So I had to physically drive to the health department's office, pick up the vaccine, and drive it to my sites. Now, the health department, they are allocated their vaccines weekly, and then from that, they have a list of providers in their area, in their region, and then they are able to ship directly. So I received vaccine directly from McKesson to me, but it is sent from the health department's allocation. They actually have to go in and send me however many doses per week.
And I think from talking to officials with the Illinois Pharmacists Association, you may have been the first independent pharmacy or one of the first in the state to have even gotten vaccines through this method. Is that right?
That is correct, yes.
Yeah, that's what I thought. And definitely, folks, if you're, don't be discouraged if you haven't gotten vaccine yet. I know that there is a strong desire on the part of the CDC and the state health departments to see the vaccine in every pharmacy. And they're working toward that. So I know it's hard to be patient. Keep reaching out to your county health departments and encouraging them, letting them know that you want to be a part of the solution and helping with it. And hopefully you'll soon be with vaccine. Okay, I want to move back to the storage and handling question. We had a comment that came in about use of ice packs, and so I guess. What I'll say here is that remember that these cold packs that we have can either be kept in a refrigerator and maintained at refrigerated temperatures, or they can be kept in the freezer and become ice packs. I don't know how all the two of you handle it, but in our the mass clinic that I run, we actually keep some in the freezer and we keep some in the refrigerator, so that if we're moving refrigerated vaccine, we're using refrigerated ice or refrigerated packs and not putting thawed vaccine onto frozen packs, because that could be terrible. That could destroy your vaccine, right?
Correct.
So so Allison, it sounds like you have the capability to do both kinds of transmissions, frozen or refrigerated. And are you using ice packs or cold packs, or how are you doing that?
So we do both, and we do it the same way. We keep them in the freezer and the fridge to transport. But really now, since we have this portable refrigerator freezer, it plugs into the car even. So we use that, and we have our data logger in that. So I have it plugged into the pharmacy. It's cold. It's at the temperature. Usually if I'm transporting to a clinic, I'm at thawed state. So I'm at fridge temp. So I have it plugged in, cold. I put it in my car. The 2 seconds it takes to unplug it inside to put it in my car, I plug it in. It's cold. I've got my data logger in it. I transport then. I unplug it. I take it in. I plug it in, and so that's how we're transporting now, is with that portable refrigerator.
Yeah. Okay, Jacinda, how about this one? How do you respond to hesitant people that say that they don't want the vaccine because it's been rushed? What's your response to that?
I think that I just always come from a place of facts rather than, dwelling on the fact that it may have been fast. I think that I always make sure to say, one, this is a global pandemic, so let's think about let's use this as an opportunity not to focus on the speed, but to focus on the things that we can do, and everyone pulls their resources together, and money is no longer an impact on the development of pharmaceutical things, as in these vaccinations. And I always, make sure to discuss the fact that the technology used in the mRNA vaccines and now with the Janssen vaccine, it's not new. It's something that when SARS and MERS did, coronaviruses aren't new to us. So when SARS and MERS did emerge about 15 to 18 years prior, this is something that they began to research. They began to purify to make sure that this could be optimized and deployed in the event that something like COVID-19 did happen. And then I also just, talk about the fact that in terms of study design, the study designs for the Moderna, the Pfizer, and the Janssen studies are very robust in comparison to other studies that look at vaccines. So I actually went through and looked at one of the Gardasil studies, and it took them 10 years to get 30,000 individuals enrolled. And I mean, these Moderna and Pfizer and Janssen studies have about 40,000 individuals in each study that were enrolled within, a 6-month time span. Like, I think that just attests to where we are in the year 2021. And I always like to say, while this may have been fast, the pandemic is something that calls for imminent action, but no steps were missed, in the development process.
That's right. That's right. No steps were missed. Very important message. And it is amazing what we can achieve as a society when we're all focused on the same goal and we're all trying to achieve the same thing. We can accomplish great things, and I think that we did. I'm going to ask Elisa Bernstein to join us so that I could ask one of our audience questions to her. Elisa, is there a need, by the way, Elisa is not only a pharmacist, she's an attorney. So she's well positioned to be able to handle this question for us. Is there a need for malpractice or liability insurance additionally while we're providing vaccination for COVID?
That's a really good question. We get that a lot. So if you've been watching some of these webinars before, we've talked about the PrEP Act, which is a Public Readiness and Emergency Preparedness Act. This is an act that allows the Secretary of HHS to provide liability immunity to categories of people. And what they've done is they've authorized pharmacists to order or prescribe and administer, and pharmacy technicians and interns to administer COVID tests, vaccines, and childhood vaccines. So if you comply with the requirements that are in these authorities that the Secretary has issued, and those are things like training or CPR and other things, then you're covered. It would not cover, though, claims involving what's called willful misconduct or actions that are outside of reasonable actions that you would take. So you're also likely covered under your pharmacy or your health system or your personal policy. So it's always best to double check those policies on your coverage as well. And but the government has made efforts to cover us in these actions as well. So thank you.
Okay, great. Well, thanks for that answer. Dan Zlot, I've got a question for you too here. Let's talk about injectable immunotherapies. Is it better to administer COVID-19 before someone receives an immunotherapy, after, let's say they're receiving a weekly dosed immunotherapy of some sort? How do we time and space the vaccine with immunotherapy?
Yeah, that's a great question. And I think the answer depends a little bit on what type of immunotherapy we're talking about. So some immunotherapies are immunosuppressive. Other immunotherapies are designed to actually ramp up the immune response. And so for therapies that are immunosuppressive, ideally you'd want to administer the vaccine prior to those as far in advance as you can to allow the immune system to develop as much of a response as possible. In the event of something that's designed to ramp up the immune system, that one, I would say probably you'd want to wait as long as possible after that before you gave the vaccine, just because a lot of the adverse effects associated with the vaccine are immune related. And so there's a likelihood that something that would ramp up the immune response might increase the likelihood of some of those adverse events.
Yeah, and it's also important for us to note that immunosuppression for any reason, whether that's due to a drug therapy or due to an underlying condition, can in fact cause us to have a blunted response to the vaccine. We may not get as high or as strong of an antibody response, and it's important to tell our patients that up front, that we believe you'll get benefit from the vaccine, but you may not get as strong of a response, and it's important to do all of those things that help prevent COVID as a part of your day, like wearing a mask, washing your hands, and social distancing. So very, very important. Several more questions that we've got coming in. I'll try to get to as many as we can. I do have questions here. A lot of people are concerned about the vaccines affecting fertility. We have addressed this subject on a previous webinar, and but I will, Dan, if you've got just a moment to give us a brief answer on the fertility question, we'll take that, and then I'll refer our audience to listen for more details in our existing webinars that are available at pharmacists.com.
Yeah, absolutely. So this is another question that we're getting frequently. And so to date, there's no evidence that there's any impact on fertility. The population right now, in terms of the pregnant population, women of childbearing age, was pretty significant, at least the women of childbearing age in the studies. And so there's certainly great data there. And the FDA in their Morbidity and Mortality Weekly Report is also taking a strong look at the pregnancies that have occurred during the study, and of course as people have been vaccinated. And to date, as far as I'm aware, there's really not any evidence that there's any impact on women who are pregnant or who are seeking to become pregnant that's been identified.
Okay, well, thank you for that, Dan. I've got so many questions that are here, and I apologize to our audience that we just can't get to all of them. There's so many questions. Let me ask, there's a question specifically here for Allison. Does the state of Illinois have any special requirements for you to transport vaccines other than your driver's license? Do you have to have any special registration to transport vaccines from one point to another?
Well, no, I do carry my pharmacist license with me as a registered pharmacist in the state of Illinois. I do have that with me so that, you know, if there ever were any questions, I am, you know, licensed in the state to do that, and I have my driver's license with me. But other than that, no, I don't believe so. No.
Okay. All right. Great. All right. I think what we're going to do now is move on to the next segment of our program. Jacinda and Allison, thank you so much for joining us. We appreciate getting your wisdom. For those of you who were not able to get your question answered, on the pharmacist.com website, we have a members-only resource called Engage, and it's a place where members can engage in conversation about different subjects of interest. And one of our engaged communities is about the vaccine, COVID-19 vaccines. So we may ask Jacinda and Allison if they would be willing to respond to some of your questions on the Engage platform as a follow-up. And I'm seeing them nodding and saying yes, they'd be happy to do that. So we'll get them started there. So thanks to the two of you for joining us. And I also want to mention that APHA has a public health special interest group. So if you're interested in joining APHA's public health special interest group, our SIG coordinators are David Steeb and Vibhuti Arya, and they would be happy to have you join. You just click on the link that's provided in your slides, and it will give you an opportunity to connect with other pharmacists involved in public health. The other topic that we have, as you all know, since we met last time, there's been some big action with the Johnson & Johnson Janssen vaccine. We say Janssen in the States, but it's Janssen is the correct pronunciation, I'm told, from those over the pond. And we have some resources available for you that will help you learn about these vaccines. There is a brand new 15 on 19 continuing education program that's just been posted on adenovirus vector technology, which is the technology that's being used for the Janssen J&J vaccine. And it'll explain how these vaccines work, their limitations, and how you can address questions that come up about these vaccines. In addition, we've updated our COVID-19 vaccine summary charts that are available in the coronavirus vaccine resources page. And CDC just this morning updated its interim clinical considerations for using all of the vaccines, including the new vaccine, the J&J Janssen vaccine as well. So lots of good things are going on at APHA, and I'm going to ask Elisa Bernstein to join us to share with us some of those good things.
And thank you, Michael. I know you usually leave me 1 minute at the end of these webinars. I think I have like 2 today, so I'll rush through this. One of the things that we wanted to share with you this week is last week was the first meeting of the HHS COVID-19 Health Equity Task Force, and this is a task force that's coming up with recommendations on addressing equitable access to vaccines and therapies. They're looking at data shortcomings, structural drivers of racism, and really ways to disrupt the system that promotes inequality. Unfortunately, no pharmacist was appointed to this task force, and APHA reached out directly to the administration to include a pharmacist. We also joined in a letter with 10 other national pharmacy organizations to include a pharmacist, still no pharmacist. So there's a change.org petition that I don't have the link here, but you can easily find it on the internet if you want to sign that. But we at APHA are going to keep pushing to get a pharmacist on this committee, along with our national pharmacy organization partners. Another thing in this area is that APHA recently joined with the American Medical Association and the American Nurses Association in an open letter urging all healthcare professionals to redouble efforts to collect and report race and ethnicity data when administering vaccines. We did that because data from the first month of the vaccine rollouts indicates that race and ethnicity data is missing in almost half of the vaccine records reported to CDC. Now, we know that it's difficult because sometimes there aren't those fields available, and you're really busy when you're giving vaccines and out in the field. But this information is really important, and so the call was to really redouble efforts to capture and report that data. We can go to the next slide. Also, for those of you about, I don't know, it was 10 days, 2 weeks ago, we sent an email out to all of our members that we got a request from FEMA asking to identify pharmacists, pharmacist technicians, and pharmacy students who might be interested in participating in the FEMA-driven vaccine efforts. And we got a really great response in only 4 days that the survey was open. And here's the data of the responses that we got. We just want you to know that we have passed on those names. If you gave us permission to pass your names on to FEMA, your names were passed on to FEMA, and your contact information. So from now on, you'll be hearing directly from FEMA on that. Associated with that, last week, the administration, or actually a little over a week ago, the administration put out the 6th Amendment of the PrEP Act. And this now covers, provides liability immunity and covers government employees, contractors, or volunteers who prescribe, administer, deliver, or distribute vaccines, tests, or therapies. So basically what the 6th Amendment does is it covers anybody who's involved in the FEMA effort, and that's way more than just pharmacists. It's all different types of healthcare professionals who will be jumping in and helping. And so this was specific for that effort. I think that's it, all I have to share. So I'm gonna pass it back. Actually, I think I'm gonna pass it to Ann Burns right now. Thank you.
Hi, Michael. If we could go to the next slide. For our audience, this is Michael's last official webinar as moderator for our weekly COVID webinar series. And we just have a small memento for you. Many people don't realize the time commitment for an individual who is a volunteer APHA president. We have no idea how Michael did that, plus his day job, plus run a mass immunization clinic, and still find the time each week to be just an amazing leader and moderator for the webinar on a weekly basis. So we have this memento, which is the golden microphone. And we always tell Michael that we think that he could be on talk shows. He's just a natural. And so it could be your second career, but you're not allowed to go far from APHA. And on behalf of all the staff, we just want to thank you tremendously for all you've done.
And thank you so much. I appreciate the APHA staff. To be real honest, these webinars would not go off smoothly at all if it weren't for the hours and hours of preparation of the staff. These are team events. I've had a great time being your host on this webinar series. And I know that your next host, Sandra Leal, is looking very forward to this opportunity to connecting with all of you as members, and she'll be joining you at our next webinar on the 25th. And so, Ann, thanks for the presentation. You caught me off guard a little bit. I wasn't expecting that. I'm grateful, and thanks to everybody. I see your comments in the question tab, and I'm grateful for that. Hey, we're not all done yet. Next week, we start on the 12th, the APHA annual meeting and exposition. It's live, folks. It's not just virtual, but it's also live, and we've got some really cool stuff happening. I've got the chance to interview Dan Schneider, Netflix's The Pharmacist. We're going to have a chance to talk to him and get his insights in real time, and you'll have a chance to ask him some questions as well. We also have great keynote speakers, and we're getting a private performance for the APHA meeting from the singer-songwriter Jewel. And so you don't want to miss that as well. This is a great time for all of us to network together and to be able to talk to other pharmacists about what's going on in their lives. So if you haven't registered for the APHA annual meeting yet, you're missing out. And I want to see you there and to give us one last chance to network together. And beyond that, you'll get continuing education credits available to you enduring for a number of months, even following the APHA annual meeting. So that's another thing for you as well. Well, I've already talked about our Engage platform. Let's get on with the CE components. Oh yes, the next webinar will be March the 25th at the same time in the same place. We're going to now move these webinars to an every other week format, and they'll be occurring on the 2nd and 4th weeks of the month. We do plan to still offer CE for the one of those webinars each month. And so be looking forward to that, with the next one being on the 25th, since the APHA annual meeting's coming up. Now on to the CE. Here are the questions. Let's post them quickly and get you to respond and see if you have figured out the answer to these examples of how pharmacists partner with their communities, or not in this case. All right. Let's move on to the next question. And we've got the response there. Participating in the federal pharmacy program is a great way to get vaccine access, but it's not about community partnership entirely. The other things are the ways that we do that. Next question. Which of the following is not a strategy for pharmacists to reach vaccine eligible populations that are immobile? What do you think about this now that you've heard from our two great guest speakers, Allison and Jacinda? And I want to thank them again for joining us today. Great information. Okay, let's close the poll. Yeah, area school systems are probably not the best way to reach the immobile groups, but if we coordinate with transportation systems, work with senior centers, housing departments, and community centers, that's a great way to reach these populations, okay? And then what's not a strategy for trust building? And we talked a lot about trust in today's webinar. How do we develop trust. And we want to pick the one that doesn't belong here. Okay, we'll close the poll, and I think you picked it up pretty quickly. National celebrities are not going to help us develop local trust, although they think they do. Ladies and gentlemen, it's been a pleasure being your host. It's been a pleasure being with you today. I pray that your future is bright and that your patients are healthy and that you have a rewarding career. It is my hope that you will receive all of the blessings that you deserve. Take care. God bless.